Good afternoon, everyone, and welcome to the University of Michigan School of Public Health Epidemiology webinar. For the next 30 minutes, we're going to be talking about the General Epidemiology program. As you can see, I'm joined by a faculty member as well as a second-year student, and they're going to share their experiences and provide any advice to you as prospective or admitted students logged in today. My name is Mary Beth Carroll, and I'm the Assistant Director of Student Affairs within the Office for Student Engagement and Practice. I'm going to have both of our speakers introduce themselves.
I'm Sidonie Kilpatrick. I'm a second-year MPH student in General Epid. I am currently a research assistant with Dr. Karvonen-Gutierrez. I do research in chronic disease epi and women's health. I went to UC San Diego for my undergrad where I studied in physiology and neuroscience, and I also got a minor in global health. I came to the program right after undergrad, so I didn't really take any time off. But I'm really glad that was a great choice for me. And then kind of just in the future, I'm hoping to pursue a PhD, work in academia in some shape or form.
Hi, I'm Kerry Karpin-Gutierrez. I'm an assistant professor here in the Department of Epidemiology. I am housed within the Center for Midlife Science. We have several centers within the School of Public Health and even within epidemiology. And our Center for Midlife Science encompasses two prospective longitudinal cohort studies, both of women that we've been following for about 25 or 30 years. And so my work is really within those two studies, focused on women's health, reproductive aging, chronological aging, and then outcomes including obesity, metabolic disease, physical functioning and disability, and falls, as well as osteoarthritis. And so I'm very much interested in the intersection between women's health and age-related chronic diseases. I teach a couple classes here in the school. I teach public health, biology, and pathophysiology, actually for our undergraduate program. I'm very interested both in my work as well as in teaching of linking the mechanistic and biological underpinnings of physiology to public health outcomes and research. And so that class is fun to bring in some of my own research into the classroom. And then I also teach Introduction to Epidemiology for our non-epidemiology students. And so it's one of our core courses that all students in the school need to have training in epidemiology, and I teach that course for all other departments in the school. And so I have a background in biochemistry, was actually my undergraduate, and then a master's in public health and a PhD in epidemiology. And I've been here at the school for several years in different capacities, working on the study and now as a faculty member.
Great. Well, thank you both for joining us. While those of you are logged in here today, please feel free to utilize the chat box. During our time, we're going to take any questions that you might have. And again, we understand that some of you might be prospective students or admitted students, so please feel free really to ask anything that's on your mind. That's why we're here. While we're waiting for some questions, something that I guess I'll ask you guys is why Michigan Public Health? What sets our school apart from others?
I guess for me, when I was applying to MPH programs and specifically epidemiology programs, I was kind of wanting to blend the biological aspects of public health. I knew I was really passionate about chronic diseases, but I wasn't really sure how I kind of wanted to link epidemiology with my physiology background. So as I started to explore Michigan and look at other programs too, I really started to see that really research and interdisciplinary work kind of go hand in hand at this program. Mm-hmm. And there is a ton of ways to get involved in research, and kind of if there's an area that you don't really know about, it's so easy to explore that option. Yeah. You can pretty much in any department or any school at U of M, you can really find what you're looking for. I've been able to take courses here at U of M that I wasn't really sure about, and I kind of was looking at the courses before I decided to go to U of M, and I found that I could take a course in pretty much any topic that I was interested in and explore that. Mm-hmm. So that was something that was super desirable for me because I wasn't really sure what I wanted to do or where I wanted to kind of navigate my career. But then I started taking courses and doing research and realizing that aging research was something that was really important to me. And then also Center for Midlife Science has so many studies that I found that were really valuable for me and for my learning and for, growth and professional growth. But there are a lot of other centers here that was I thought it was very interesting and very informative to learn about those before I came. I also really liked how the School of Public Health is kind of like a family. You don't really leave here, so all your classes are in this building. I remember on Prospective Student Day, pretty much everything was here. You don't really leave, which is very desirable because I went to a massive undergrad where you easily took 20 minutes to walk across campus to your class and you were just sweating when you got to class. So it's nice having kind of that downtime going from class to class, and pretty much everyone that you work with, faculty, staff, are all housed here too. So it's not like you feel disconnected at all. And that was something that was really important for me, moving from California to a new state, a new kind of environment, lack of a better word. So that's really what I liked coming to U of M. And now that I've come here, I've just had an amazing experience and learned so much. I've grown a lot as and academically and professionally and personally too, which has really been great. And everyone's been really supportive. Faculty, that there's anyone that you have a question about, you can ask, whether it's professional or personal. There's always someone there that can kind of help you out and guide you. And to the mentorship, that was really something that I was looking at when I decided to come here. I identified a couple different faculty members that I was really interested in learning more about their work, and everyone was really welcoming, would really allow me the opportunity to learn more about what they're doing. And if I had a question about a random topic that I learned, and I wanted more advice or more details on that, I could kind of learn more. So it was something that I really liked.
Yeah, I think building off of those are all obvious answers for why Michigan is a great institution, not just to train for public health, but broadly. It's a huge campus. There's a lot of opportunities. Many of our students take classes at the medical school, which is right across the street, or at the Institute for Social Research, or within the School of Natural Resources and the Environment. And so there's a lot of areas that are related and tangential to what we do in epidemiology that students can get cross-training in because our field is so interdisciplinary. I also think that a reason that the program here at Michigan is really strong is that we have faculty that have diverse content area of expertise. So mine is aging. We have folks who do environment. We have folks who do occupation. We have folks who do infectious disease. But really kind of across the board, our strength is really in methods and understanding epidemiologic methods and training our students to really use methods in a novel way. And so understanding study design, different types of analysis, things about confounding and effect modification, and really focusing on those core epidemiologic principles, and then having the space for students to be able to apply those core principles in many different environments that are related to their own content area of expertise. And that's supported by the fact that we have many faculty here in the school that are doing primary data collection and actually allowing students to be part of the research process. We certainly have students that work in our group, and that's true across the school and across the department. And that's a way then that students can not only support the research that's going on within the school, but also then apply their methods training in a way that is unique, and then ultimately culminating with a capstone experience that is a data analysis and writing opportunity. And many times we see, as in Sidonie's case, that that's an opportunity that has grown out of their work in the research environment that is related to and supports kind of the ongoing training. And so we see examples like that across the department where students are able to get integrated into labs and have that real world opportunity.
Yeah. What advice would either of you give a student logged in here who wanted to get into research? What maybe should they do if they're thinking about coming here?
Yeah, that's a good question. So for me personally, I wasn't really sure what type of research I wanted to get into, but I knew I wanted to kind of look at chronic disease, aging. How I became involved in Dr. Karvonen-Gutierrez's research was actually just by chance. I was reaching out to faculty members, and I was really interested in study of SWAN, so study of women's health across the nation. I was just really interested in that study, and I started reaching out to people that were involved in that study. and I realized which SWAN kind of looks at women's health across the menopausal transition, looking at premenopause, perimenopause, and then postmenopause and kind of health outcomes, so reproductive health, bone health, and then other cardiometabolic diseases. And so I reached out to Dr. Siobhan Harlow, and just through that, I ended up actually getting involved in Michigan Bone Health and Metabolism Study. So Dr. Karvonen-Gutierrez is principal investigator on that study, and that ended up being my internship over the summer. But I was able to start kind of earlier in the first year and do research and help collect data. And for me, that was really helpful. But also too, I think the best thing that I can recommend is just reaching out to faculty members, emailing them, expressing interest in kind of their experience and their backgrounds and how you can get involved in research like theirs. There's so many different research areas or research studies, so just reaching out to faculty that you're interested in is really helpful, especially with what types of data you can access, or because sometimes too you have faculty members that aren't actively collecting data. They're using kind of data sets that have already been collected and they're just analyzing it, or they're going into the field like we were, where we're actually recruiting or have participants coming into our clinic. We're collecting information from them, administering surveys. So I think it's also really important too to kind of look at what type of research do you want to do? Do you want to do more of the analysis side, or do you want to do more of the like primary data collection? So kind of understanding what you're also looking for experience is really helpful. But it's very easy to find the faculty. It's just reaching out to them, making sure that, you know, what your goals of I guess, expectations of the research experience is important to kind of get that before you reach out to people.
Yeah, and I would follow up on that by saying certainly initiating an email, you know, gaining your interest, but then being very deliberate and thoughtful about what it is you're looking for and what it is you have to bring to the table. Does your experience need to be paid, or do you want to do it for credit? Right. Is it going to be a volunteer opportunity? Right. Do you want experience that will give you certain skills, and if so, what are those skills? Because you may have a lot of experience collecting data, but you want experience with analyzing it. And so really giving a faculty member an idea of what you're hoping to get out of the experience. And then thinking about what the longevity of that involvement is going to be. Is it going to be something you just want a short-term opportunity and see if you like it, or is it something that you want to carry through into an internship and then maybe even beyond? You know, you're here for 2 years for a master's program. And so it's nice to be able to find students that want to have an extended experience, but you don't always have room for that many in a lab. And so even thinking about how can you create a shorter experience, or might that faculty member have collaborators, of course, that are looking for good research assistants or something like that. And so that's, you know, really just starting that conversation with faculty that you share interests with, and see if they have suggestions of where you might be able to go.
Yeah, all really good advice. Definitely a lot of opportunities. While research isn't always required, it is a great benefit if it is something that you're interested in. A question here from Haley: what are some of the benefits of the general epi track versus the other track?
Well, our department sees the general epi track is really focused on very strong methods training. And so it's an opportunity for students who really want to be able to have the flexibility to develop their content area in different ways, but really focus on strong methodological training. And so unlike some of our other tracks, like the occupational and environmental epi or our hospital molecular epi, which already are prescribed in terms of the type of content area one would go into those with, the general epi program allows students to have the flexibility in their schedule to be able to get very strong methods training, but then perhaps pick up a certificate or other coursework there where they can hone in on a certain area that they're interested in. And so this is a track that's commonly used for students perhaps pursuing a PhD, who perhaps want to go into government work, who perhaps are planning to go to a professional program like medical school or something thereafter, and so really want to be able to tailor the program but still get you know, really cutting edge, rigorous methodological training. And so it's a way to be able to really customize that degree in many ways for an individual.
Great. Anything you want to add?
Yeah, I've felt like I've had a ton of flexibility with my coursework. I've been able to take classes that I realized I didn't have a certain skill. So for example, we use SAS primarily in this program, but I've taken I'm currently taking one, but I've previously taken another course in R. And so I've been able to learn R, GIS, take other courses that apply the methods that we learn in our coursework and apply them to different topics. So like I said, the aging course that I took, communicable diseases, different various electives like environmental health coursework, and kind of apply those methods that we learn in all of our classes. And being in general epi, I think it's valuable to have that strong methods, because you really can take those, foundational skills and apply them to any topic that you want. And especially with a master's, it is longer, 2 years, but it is very short. Like being in my last semester, it is very short. So I don't necessarily know, like maybe 2 years down the line, I might be interested in another topic. Like I'm not sure, but if I'm interested in more of reproductive health, I can use the same methods and the same tools that I've learned in all my courses and apply that to that topic, versus learning only one specialized topic relating to those methods and not really knowing how to go back and forth. So that's really why I like it, and I've had the flexibility. So one semester realizing that I don't want to take this course, like a certain course that I'm signed up for, because maybe I'm not interested in the topic anymore. It's not a required class, it's an elective. I also have a ton of friends that have taken courses in other concentrations, so it allows them to kind of explore like health behavior, health education, take environmental health classes, take some biostats classes, and learn different skills that maybe they supplement areas that for their research interests they wouldn't have necessarily with epidemiology. Because the thing that's really nice is some students go into academia and some students also go out, or a lot go out into kind of like public health practice. So learning skills that are outside of the realm of public health, I think, is also very beneficial. I know someone that's taking a class at the School of Public Policy, and that's really what they want to do, is do policy work and also understand, kind of have that strong epidemiologic background. So I think that it's a very helpful kind of, I think personally, but I'm biased. I think it's very helpful if you want to explore other avenues too.
All great points. Speaking of SAS, there's a question here. I'd be interested in learning more about the statistical programming training for general epid students.
Yeah, so our general epi program has a SAS course that is a required course. I think it's called Epi 640, if I remember off the top of my head. And that course is a course designed for people who've never used SAS before. And so it's one that starts with thinking about data management, how to open the software, how to read in data sets and manipulate those data sets, and then how to do some introductory analyses in there as well. That's really to be able to work with SAS independently. Of course, then many of our biostats core courses, which are required for our general epidemiology students, will require some programming as well that is a little bit more prescribed, and so to really work through the analyses that they're working on. And some of that happens in SAS, and if I'm not mistaken, Sidonie can correct me if I'm wrong, that also may use R or even Stata sometimes. But primarily the course that is required in our department is a SAS course. And then we do have other cross-training that they can learn other programming languages.
Have you taken any of those courses?
So all of my coursework is in SAS. My capstone is also in SAS right now. But I had no experience using SAS before I came here. So you do not have to know how to use SAS. And honestly, someone recommended it to me when I decided to come to Michigan. They said they didn't recommend learning it learning it on your own, because U of M has a specific way that they teach it. And I think that was really beneficial for me, because I didn't have kind of this way that I learned it myself. So I just kind of was thrown into it, and I thought it was very helpful. But I'm currently taking, and I had taken an R class. One was a 7-week course, and it was kind of just like an introductory course. And they give you amazing skill or resources. I think it was great for me. And then I'm also doing a longitudinal analysis of environmental health data class. So I'm learning how to do longitudinal analyses, and then also using it in R. which has been cool for me because it's kind of a 2-in-1 class.
Yeah.
I learned GIS, but that's not necessarily a data management or a data analysis program, but that also is something that I've heard a lot of alumni that have come back have said that's an important skill to learn. So I kind of took that course just to see if I liked it, because it was kind of an introductory course too. But you can also take analysis classes outside of the School of Public Health. You don't necessarily have to only use SAS. And like Dr. Karvonen-Gutierrez mentioned, in our biostats classes, you have the option of doing SAS or R. I do recommend using only SAS just because exams are in SAS, but you have the option. So if you're ever curious, we want to do this type of analysis, they give you the SAS code and the R code. So you have the opportunity to learn both if you want to do that.
So to those of you logged in, we have just a few minutes left. So again, please feel free to ask any questions that you might have. There's another question here from Tina asking, are there any other courses highly recommended by returning alumni?
It was definitely the GIS course. I don't remember the name off the top of my head. A lot of the courses were the required courses that we had to take, but they've been so helpful. So in our 640 class, so the SAS class, the introductory to SAS class, you have a midterm and it's open note. And our instructor recommended that we make a binder of all of our notes. And I still have that binder. I use it all the time, just as kind of like a reference for anything I have a question on for SAS. I think, GIS right now has been really helpful because it kind of is a system or software, I guess, that helps you kind of graphically look at trends in data. I think that's an important skill to visualize data. But I think in general, any program that visualizes data, I think is something that's really helpful. And then the only other courses that people have recommended have been very specific to their field. So it's hard to recommend maybe just specifically one. But there's so many courses. The problem is choosing one, because you have your required courses and then picking the electives that you have and which ones you want to do.
And each student at the start of their time here is matched with an academic advisor who's a faculty member within our department. And so we try to match students with faculty who have shared interests, perhaps not completely overlapping, but who can really help let them know not only about courses in our department, but also throughout the school and then throughout the university. And so particularly for students taking certificates, they will take courses outside of this department. But that's open to any students, and so the academic advisor can certainly help in making those suggestions, which, as Sidonie mentioned, are sometimes very specific to students.
Of course.
I think we have some excellent courses across the board, but it really depends on that student's individual interest.
Speaking of electives, about how many electives are students typically able to take?
On the top, off the top of my head, I would say probably for General Epid, I would say maybe 6 courses. I know my friends in Global Health, the GHE course, Global Health Epid, they have 2, I think, 2 or 3. We have a couple more, but it depends on how much coursework you want to take or course load. I've taken 18 credits before, and I realized that was too much for me. But I was able to get 3 electives in that semester. So it really just depends on if you're taking a course and you're really passionate about it. You might have to not overload, but take more credit. But I think I've taken about 6.
And that depends a lot on whether a student is doing a certificate, because then, of course, that certificate would not necessarily be electives. They would be required for the certificate. It depends on whether or not they're doing any dual programs. So sometimes we have students who are doing dual degrees. And it depends on how many credits they want to take per term. But there are certainly, and they can go online to our website and look at the degree programs for a 60 credit GE student and see kind of at the minimum how many electives they're allowed, but then of course thinking about their individual situation, how that's going to change things.
Okay, thank you. One more question here. I know we got to close out related to what type of fieldwork students are doing in the program. Any comments on that before we sign off today?
Yeah, so we have the FAST, so Public Health Action Support Team. So that's very, you go into the field, they have short-term volunteer opportunities, long-term projects, and then they also have deployments of volunteer deployments. I think they had it in Grenada, and then also Texas and Mississippi. That's very hands-on work. I've been involved in FAST, and I really enjoy the program. It's great for organized volunteering. Also, I am the community service chair for epidemiology student organization, and so I try to create opportunities for the department and for students to kind of get involved. So, for example, we did a blanket making event for the Ronald McDonald House, and then also we went around Ann Arbor and did this door hanger campaign where it had mental health services kind of phone numbers. But also too, really, there's always something to get involved in, whether you link up with a faculty member that goes into the field. So if you're interested in more of like that environmental health data, there's every opportunity to get involved in that. And always partnering with another faculty member or organization outside of the School of Public Health. I know people that work at outside organizations too as like a part-time job, and they're able to do public health practice. So you're really not limited to only doing coursework. I mean, I know some people that do that and that, works for them. Or you also have some people that also want to supplement their academics with a part-time job or volunteering. So it really depends on what you want to do and kind of how you can manage your time. So.
And all of our students will do some type of field work based on their internship. And so that's important to remember that even if you don't choose to work during the academic year as an employee or do a research assistant type position or even engage in volunteer activities, the internship is a required portion of our program. And so all students will be placed. Some are placed in academic units, with doing different types of research, whether it's field work, working in our clinic and recruiting participants, working on the ground and collecting soil samples, going to hospitals. I had a student this summer go to Ghana and was collecting some medical record data, doing some extractions there. And so really, those are very diverse, but it can also be more practice-based. So we've had students who are seated with the health department, the state health department, the county health department. We've had students work with the Injury Prevention Center here at Michigan Medicine and doing car seat checks at our children's hospital. And so those are really varied and offer the opportunity for a student to really hone in on something that they're really interested in. But all students will get some type of hands-on training with either data collection or some more public health epi practice as well over the internship.
Great. Well, thank you both for your time today, and thanks to all of you who logged in. Please feel free to email us if you have additional questions. There was one question that we didn't get to in regards to the EPI PhD program, so please feel free to email us at sph.inquiries. We're more than happy to help answer any questions that you have. With that, thank you so much. We look forward to connecting with you soon.